Welcome to another wonderful episode here in Doctors of Podiatry. We have a super duper interesting case here today. We have the pleasure and good fortune of having Dr. Gabriel Saloom, S-A-L-L-O-U-M, plastic surgeon. Today we are performing an adipose-derived stem cell injection for a patient with an end-stage arthritic ankle joint. But what I want everyone to see is basically, this is how we harvest fat, okay? We use fat for a lot of different clinical presentations in the foot. One of them being what we're doing today, an adipose-derived stem cell injection. Our fat contains a lot of stem cells. Another place where we find stem cells is in our bone marrow. I want Caesar to focus on this. And by the way, this is called a lipo aspiration. This is not liposuction. Okay, big difference. Okay, so Dr. Saloom has already numbed the area, and what we're basically doing, this is called a cannula, and so it's like the perfect size to make sure that we don't injure the fat. The fat contains these living cells. We pour, right now it's a combination of blood, a little bit of some of the anesthesia, and this is basically like cooking class, right? There's a kind of, right?
Yes.
Underneath there's a little dressing, a special dressing.
Just absorbent.
And it's absorbing all of the oil, right? Fat contains oils, lots of oil. You guys are gonna see now. You know, these procedures just never get old. If you guys look at the original dressing, that's where all the oil has been left behind. And now everyone can see the consistency has changed, and the color too. We're leaving all the blood and all of the different fluids behind it. Now it starts to turn a little bit more, say, clear, right?
Pure fat.
Beautiful. So now we take the fat, beautiful living fat, and put it into the syringe. Okay. Every time we post this on any of our platforms, people are always joking around. Why don't you fly me down there? I have enough fat for blah, 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 blah. But again, not only do we, in this particular case, we're using it for a stem cell injection. It's not a miracle injection, but we also use fat for fat pad restoration. And other uses as well. So now what we're going to go ahead and do is we're transferring the fat into 1 cc syringes. And Dr. Saloom, can you explain what's in that little green and purple?
Yeah, so this is just a lure-to-lure transfer device, so we can transfer fat from a 10 cc syringe into these small 1 cc syringes, which gives better control and more precise deposition of the fat.
And again, whether the ankle or any other location, we like to use the 1 cc syringes.
There you go.
Super. So now what we're gonna go ahead and do is we have our fat. Now we're already spinning the platelet-rich plasma, and we're gonna go ahead and mix that up. We're gonna create this incredible cocktail of fat and PRP, and just this incredible just concoction of regeneration. And that's exactly what we're going to infiltrate in a couple of minutes now. Okay. Just for all the people out there, patient, how did that go? The lipo aspiration part? Easy. Okay. And everyone saw it took about maybe 3 minutes tops, depending on what we're doing. Sometimes obviously this is only an injection, but we sometimes usually isolate, 6, 10, 12 cc's, sometimes even more, to really hyperinflate those areas on the bottom of the foot. We also use it, that's the procedure that we call the Brazilian foot lift, and then we have the anti-aging foot lift, where basically a lot of women that come to see us because they don't like the way that the top of their feet look like. There's a saying that look at someone's hands and that will sort of give away their age. So a lot of individuals come here for that. So we also perform that on the top of the foot, just like the hands. And then come around here, Caesar, please. And again, no sutures, just a little steri strip, just like that. And that's it. We're gonna go ahead and leave the patient here. We're gonna clean everything. We're gonna put a standby here, and once the PRP is ready to go, then we'll continue the procedure.
A few moments later.
Okay, ladies and gentlemen, so we're back. We have already isolated, the fat. We have isolated a little bit of the PRP, and now we're gonna go ahead and infiltrate, the ankle joint with the goodies. Without further ado, okay? Here we go. The patient has a very verbatim from the MRI, a severely arthritic joint. A lot of osteophytes, a lot of bone spurs. So I already disclosed to the patient that it may be a little bit difficult to try to get into the joint. We did do a little bit of distraction just to kind of loosen up the joint. So we're going to tell the patient just to hold right there. Okay, that's our spot, and here we go. Easy. Okay, so we're in. Okay. So here we go. Okay. You okay, patient? You missed that? There we go. You okay?
Mm-hmm.
fat. Dr. Wagner, how do you know when is too much resistance? What I'm going to do is I'm going to stop here. And I'm going to let the patient know that there may be a little bit of discomfort now in the ankle joint. Okay. Just infiltrating slow. You okay?
Mm-hmm.
Pain?
Mm-hmm. It's okay.
Okay. What I'm going to do now is I'm going to put a little bit on the other side as well. Okay. Stand by. Okay, everyone. So we're all done with the procedure as planned. We did an adipose-derived stem cell injection for the diagnosis clinical presentation of severe osteoarthritis of the left ankle. A lot of people these days just simply want to exhaust all conservative therapies before undergoing the knife, right? People want to avoid the knife. And we were just talking before that in the world of ankle end stage, ankle joint arthritis, there's not a lot of alternatives. Fusion, total ankle replacement. There's not a whole lot. Patient's very young too. So, fact. But you know, we continue just like we used it today on the ankle. We also use it for Achilles tendon issues, plantar fascial issues. The sky's the limit. Fractures, and I can go on and on and on. Patient did very well, and it took about maybe 45 minutes to an hour between isolating, spinning, and performing the procedure itself, which was probably the easiest part of the entire procedure. If you guys have enjoyed this video, please give us a like, leave comments, tell friends, family, workers, co-workers. Make sure that you guys turn on those notification buttons. Make sure that we do continue to upload videos every single day. So for all the non-subscribers, please subscribe. And we'll continue our to embark on this journey to make sure that we educate the world one toe at a time, or one foot at a time. Thank you for watching.